Welcome to TRADOC Talks. We're joined by Colonel Chris Meyering, the Command Surgeon for the U.S. Army Training and Doctrine Command. And today he's going to talk to us about COVID-19 or the coronavirus. Welcome.
Thank you, gentlemen. I appreciate the time to come here and get a chance to share some information that we have here at TRADOC headquarters, and just kind of enlighten some folks about things that they can do for themselves and things to protect themselves, and then also get more knowledge about this particular virus. So again, this is the 2019 novel coronavirus. It's also being called COVID-19 in the media, so you may hear it called that as well. So earlier this year, January 30th in 2020, the World Health Organization declared a public health emergency of international concern for coronavirus 2019. This has been spreading in multiple different countries, and it's thought to be spread mainly from person to person. What that means is that these are people who are in close contact with one another, and it's usually within about 6 feet, and that's spread through the respiratory droplets. So when you cough or when you sneeze from an infected person, those droplets can land in the mouth, nose, or even the eyes of people who are nearby, or they could be inhaled into the lungs, and then transmit the disease that way. So people are thought to be most contagious when they're most ill and displaying a lot of these symptoms, although some of the exposure may be possible before people even show symptoms or be asymptomatic. This can occur with this new virus, because it may take several days after being exposed before your symptoms show up. It's very common with most viruses, but that's one that's of great concern for this particular one too. It's also possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or even their eyes. This isn't the typical way that it's thought that this virus is spread, but it is very possible too. We know that it can last for an unknown amount of time on things like door handles, keyboards, phones, things along those lines. The amount of time is being researched currently, but first reports it seems like it can last for about 5 to 7 days on most surfaces. The virus that causes the COVID-19 seems to be spreading easily, and it's sustainably in the communities in some affected areas. Most commonly, it's in China, Iran, South Korea, Italy, and Japan. That has been spreading, increasing in the amount of its spread in countries like Germany, France, Spain, and even the United States right now. Spread means that people have been infected with the same virus in the area, even though they may not have traveled to countries of concern before they became infected with COVID-19. So a little bit about the symptoms that you might get with that. Could be some mild symptoms to severe illness, even death, for some people, with the COVID-19. Those symptoms can come up maybe 2 to 14 days after an exposure, and usually those are going to be fever, cough, shortness of breath. They can be similar to common cold or common flu. So you could have a runny nose, sore throat, that comes along with that. The only way to determine if you have actual COVID-19 is through a validated Center for Disease Control, or CDC prevention test that's done by medical professionals. A lot of these symptoms that I just described are common for a lot of viruses. So it's not, if you come down with any of those symptoms too, and you haven't been exposed to anybody, don't automatically jump to the fact that you have COVID-19. If you believe that you've been exposed to someone that has been diagnosed with COVID-19, or if you yourself are exhibiting some of the COVID-19 symptoms and you're concerned, we just suggest you immediately contact your physician, and that's preferably by telephone or other electronic means. The best thing is to not go directly into any of the clinics prior to contacting your own provider. If you have been exposed to COVID-19, we don't want to spread it to other people who may not have contracted that disease too. And so we want to try to talk you through, some of the symptoms that you're having, and then we want to give you some, better reassurance if you should not be concerned, and then give you guidance on what you should do if we do need to test you. Just to share that this virus does seem to hit people over 60 very hard, regardless of how healthy they were before. And the overwhelming majority of the deaths from the virus are people age 60 and up, and those who have other significant conditions. So I mean things like diabetes, if you have lung disease, heart disease, and then just so that you understand too, for those who are surviving, the people who are hit significantly with that, the average inpatient stay in the hospital is 21 days. If you compare this to the other end of the age spectrum, where there's been no deaths for around the world, for children that are age 0 to 9, even if they had some other health conditions, and the majority of young people who will get minimal cold symptoms, like a runny nose or a cough, even though they could be without any other symptoms, and they can carry the virus and spread it to others. So this was seen when people were tested with COVID because they got the test because they were known to be living with a known case. And some of those individuals, they tested positive for having the virus, but they were completely asymptomatic. And that came from some of the Chinese CDC studies, and then also from the Japanese studies that studied some of the cruise ships. To explain that even further, so some kids or other kids, teens, can transmit the virus, and they may not know that they have the virus, or they may just have such minimal symptoms, that they're unaware of what it is that they have.
Sir, so what is TRADOC and the Army doing about this?
Yeah, so really the Army has been taking some excellent precautionary measures, to protect the health of the force and to maintain the operational readiness. So our TRADOC's number one priority is our people, and so we've been continuing to evaluate the current day-to-day operations to ensure the safety of all of our soldiers, all the family members, and the civilian personnel. And so we're really encouraging all personnel to follow the guidance that's been issued by the CDC and then by your installations themselves. We rapidly implemented some stringent health and force protection measures to really try to seize control and prevent the spread of COVID-19. So don't be alarmed with any of those. We are just trying to catch as many individuals as possible. Give them good guidance on what it is, how they can care for themselves. Because really prevention starts at the individual level, and then that might mean controlling access to the installation and then protecting the critical assets and the personnel who operate them, and then enforcing strict personal hygiene procedures when those are applicable.
So as we look at prevention and really focusing on those individuals, what are some of the measures they should probably be taking in order to make sure they're preventing?
Yeah, so really important that everybody follows just some individual measures to keep themselves well. Now, this isn't just necessarily for COVID-19, but this is for all diseases. So this is guidance that we've put out for the flu, to prevent you from getting the flu too. So really, doing proper and frequent hand washing. So that means washing your hands for 20 seconds. So if you need a little song, you can sing Happy Birthday. You can sing Twinkle Twinkle Little Star, your choice, or you could use disinfectant wipes and then alcohol-based hand sanitizer, readily available. You can avoid some unnecessary physical contact with others, so things like handshaking, just avoiding touching your eyes and your face and your mouth. Just so everybody is aware, too, that is a bigger challenge than most people realize, to not touch your eyes and your face. You're going to have to take active, thinking on your own part to avoid touching those areas. But it is extremely important, as that's a significant way of how we can transmit disease. For respiratory hygiene, so this isn't really to protect yourself, but more to protect others from what you might have. It's covering your mouth and your nose with a bent elbow if you're going to cough or sneeze. So just really just putting your face into the crook of your arm when you sneeze, and then don't do that into your hands. But if you accidentally do it and then sneeze into your hands, if you clean your hands immediately with a hand sanitizer or wash your hands too, that helps prevent some of the spread. If there are common surfaces, that other people use, like if you at your workplace, if there's a shared phone, if there's shared computers or anything like that too, frequently wiping down the surfaces or using hand sanitizer after you use them. Also other things too, like if you open the door to the gym or open the door to a restaurant too, just remembering that you need to wash your hands or just clean them off before if you have to touch your face or your mouth at all. Biggest thing is that if you feel unwell, then stay at home. So contacting your own supervisors, kind of letting them know how it is that you feel, then contacting your physician or your wherever you receive care, just to kind of let them know about your symptoms too. So really, if you are feeling like ill, then leave, staying at home basically.
Now we've seen a big surge in terms of purchases of facial masks and seeing them all over the place. Is that something necessary? Is that something soldiers need to have?
Yeah, that's a great question because unfortunately we've seen a lot of run on for people trying to grab masks, but you do not need to walk around with a mask to keep from getting sick. Really, typical surgical masks are for sick people to keep them from spreading their germs to well people. They're not intended for well people to keep from getting sick, because you can still get droplets in from the side or actually even into your eyes too with wearing the mask. So people are like, I see surgeons that are wearing the mask too. So really, those were brought about to prevent the surgeon's own germs from infecting the patient that they're working on too, and that's where they saw that the infection rates in surgeries really dropped significantly. It's to protect so when you cough or you cough or sneeze into the mask itself. Don't take the mask off to cough or sneeze. That's there to try to catch those droplets and keep them from spreading to other people. Really, another thing is if you're out and about, just using some social distancing when you're going out, just using about 6 feet of distance from most people, trying to avoid large gatherings, like sports events, concerts, festivals. There's going to be some changes that come about for the organizers of some of those events too. And if in your community, if it seems like there's a real increase in the number of cases in that location too, they'll probably put out some additional guidance, so pay attention to that.
So all our introverts now have excuses not to go to social gatherings.
Yeah, exactly. Yeah, this is definitely their benefit.
So what is the Army doing? We talked about what is the Army doing generally. What is the Army doing different on installations right now? What do we think? What kind of, if you live on base, things like that, what kind of changes might you expect?
So we're doing several different things, and it depends upon the location too. So we are actually screening our new recruits that are coming in before they even show up to the MEPS. We're giving them some guidance as far as the restrictions to travel to some of the different countries that are on the list. That have the higher number of cases. Having them check for their own symptoms too before they show up, to the shipping locations, and then checking them again at the MEP stations, before they get onto the bus. We're checking people at the airport, new recruits as they come to the airports, and then at all of our installations too. So anybody that's showing up for training, they are getting screened, by the treatment facility folks or by the unit itself, and then just checking for symptoms too. There's been fantastic coordination between the treatment facilities, the military treatment facilities on all of our installations, and the command teams at those locations too. There's been coordinated efforts, rehearsals about how to do the procedures that they have in place, where people are supposed to go, where they would get tested. And so on. Just one other thing too, because there are different levels of guidance, so you'll probably hear some of the terms as far as quarantine and then isolation. Just to clarify for everybody, quarantine means that you may have had an exposure, to somebody that has this particular disease, and you are well. You're well, but you don't have any symptoms yet. We're just waiting to make sure that you're past the point of where you could start to become sick. So you may get told, we need you to be in quarantine. It's not a need for panic. It's just that we just ask you staying at home, do a self-quarantine, watch for some of the symptoms, and then if you start to develop any of those, whichever treatment facility where you happen to be will give you some guidance as to who to contact at that particular location, and then how you should seek out some care.
Can you define real quick, just more technically, exposure? So I don't want to say I've been exposed if, there's one case in Virginia and I live in the state of Virginia. So can you explain a little bit in terms of exposure so people know, when they've truly been exposed?
Yeah, that's a great point, because there are a lot of people who might get concerned, where there may have been a festival that was 2 blocks away from them too, and they felt that they were quote unquote exposed, to somebody that may have had that disease too. So really, we're talking about somebody that has truly tested positive to the disease, where they had a confirmed test, that documents that, and you were within close quarters. So if you were within that 6-foot distance, with that individual, maybe if you had shared some particular items, sharing a keyboard with somebody that tested positive for that, talking on the same phone, with that individual, touching some of the same objects that they may have too. But if just because you happen to live in the same state or even the same city or town of somebody that had that particular disease, or say if you even walked into the hospital and they happen to have patients that are in the hospital that have that, you've not been exposed. It really takes that level of close contacts, for you to truly be exposed to somebody.
Sir, what are the treatments, if any, for someone who's contracted this disease?
So right now it's more supportive treatment. So again, just staying hydrated. dehydrated, just the typical stuff that you would say for somebody that has the flu or a regular cold. Just kind of watching for those two. Just drinking plenty of fluids, getting rest. Listening to your body, actually sleeping. But there's no specific treatment for the illness that's caused by the COVID-19. I will share that there's a lot of research that's ongoing right now as far as for trying to develop a vaccine for that and an actual treatment for it. There are some medications that are experimental right now, just to see if they would be effective to treat it. But there's no specific treatment, for this particular disease right now.
So, sir, obviously this is a serious disease that we're following right now. What else would you like to share with the soldiers and leaders out there from TRADOC?
The biggest thing is that just understanding about it, about what this disease is, not panicking, just kind of following the guidance that's at the MTF, just understanding that your Army leaders and TRADOC leaders and all the leaders at the installations and the treatment facilities at those installations have really done a lot of work right now. We are far forward in as far as for protecting all the people that are in our communities and that work on our installations too. So just be reassured about that too, just understanding what all's going on. Also know we have the Walter Reed Army Institute of Research and U.S. Army Medical Research and Development. They've been working on efforts to try to help contain and control the spread of the virus too, coming up with some additional diagnostic testing, to kind of, that where we can, find out who might actually have this too. But there's been a lot of strong work that's done by a lot of high-level individuals and a lot of amazing researchers too. And so the science behind everything too has been nothing short of amazing right now too. So I'm very impressed by how everybody has responded to this too.
Well, Colonel Meyering, thank you so much for taking the time out today to talk to us about the COVID-19, how to take precautions against it, and how to make sensible decisions here. So thank you very much.
Yeah, thank you very much, gentlemen.